Peter Gusky with the Back Saver System. I'm here today to demonstrate a self-mobilization technique. You can call it an exercise if you like, the purpose of which is to dramatically decrease and even abolish neck, upper back, shoulder, and arm area pains. These are pains that are oftentimes misdiagnosed as a problem that's in the shoulder itself, because the pains will manifest themselves there. In other words, that's oftentimes where you feel it. As mentioned, it's oftentimes accompanied by pain in the back of the neck and covering the entire shoulder blade or upper back area. These are pains that can even oftentimes extend down the arm, into the hand, and even into the fingertips. Here's the way this exercise works. First and foremost, if you're going to do it in the sitting position, and it's done most effectively while sitting or standing. If you're doing it in the sitting position, which is oftentimes when these pains arise when we're sitting, you have to make sure that you're not in the downward slouched position that so many of us find ourselves in when we're working on a computer or sitting for extended periods of time. You want to make sure that you're in the slightly arched inward position with regard to your lower back. In other words, good sitting posture. If your lower back is not arched inward, these neck, shoulder, upper back, and arm area pains will persist. This exercise to remove pains in the neck and upper back simply won't work unless your lower back is arched inward slightly in this position. This is where we have to start. The first part of this exercise is a movement that's awkward. It's a strange little movement. It's a position or movement that your body needs to get used to. I'll demonstrate it. Here's the way it works. You take your head and slide it backwards. It's hard to speak at the exact same time that you're performing this exercise, but I'll do my best for this demonstration. You slide your head straight backwards, and then, taking your fingertips, give yourself just a very gentle push backwards with your fingertips. I'll demonstrate again. Slide the head backwards, then push with the fingertips, and you'll notice that I pushed and held that slight amount of pressure for about 3 to 4 seconds. I'll demonstrate again. That is the exercise right there. It's nothing more than a sliding of the head with some overpressure held for 3 or 4 seconds. That is the exercise, and it's the first part of an exercise that really is 2 parts. And I want to demonstrate the second half of it here now. In the second half of this exercise, you first perform the first part, which I just demonstrated, a retraction or a sliding of the head backwards, the overpressure, held for a few seconds with your fingertips. But this time, at the end of this repetition, I'm not going to just relax and let my head come forward. This time, I'm going to try to hold that retracted position just through muscular force without the assistance of my hands, making sure that I maintain that retracted position. And from this retracted position, and again maintaining it, I now tilt or extend my head backwards again. At the risk of being repetitious, you have to maintain the retracted position as you do this. As I begin to tilt my head backwards, I'll reach a position where I feel a strain or a stretch or the limit of my motion. At that point, I now rotate my head back and forth, side to side in this manner, as I try to go just a little bit further with the tilting or the extension motion. When I can't go much further, I hold 3 to 4 seconds and then slowly and gently bring my head forward again. So it's a 2-part exercise. The first part, which will be the only exercise that you're performing initially, consists of nothing more than a retraction or a sliding of the head along with some gentle overpressure. And that's it. The second half of the exercise, which you will advance to as this exercise becomes easier for you, the second half of it consists of the tilting. But it's very important, as I've mentioned, that you perform that tilt or bending backwards or extension of the head while you're in the retracted or slid backward position. I'll demonstrate it again. Here's the second half of the exercise. Then backwards, slight rotations when it gets tight in an attempt to go back a little bit further, then a hold, and back to the starting position. So you have two parts to this exercise. The initial part, where the beginners start, is the retraction. And the second half is the extension or tilting backwards of the head. As you become more proficient with this exercise, as you're performing the first part and the second part, you can incorporate the two into one movement, like this. You retract, push, let go and try to maintain the retraction as you now tilt the head backwards. It starts to get tight. You perform the little rotations in an attempt to get back further. You hold 1, 2, 3, and then back to the starting position. I'll again demonstrate incorporating the first half of the exercise, which is all that will be performed by the raw beginners, into the second part of the exercise. Again, this is what you'll do as you become more proficient, and I'll demonstrate the entire sequence, which is incorporated into one exercise as you become more proficient, and I'll do it right now without speaking. That right there is one repetition of the exercise, an exercise that you'll be performing for 5 to 10 repetitions in the early stages at a frequency of once every 1 to 2 hours, or whenever you start feeling strain or pain developing. It's very important also when you perform this exercise that in between bouts of exercise you maintain good cervical and head posture. You can perform all of the self-mobilizations, all of the exercise in the world, but it will do you very minimal, it will do very minimal. You can perform all of the exercise and self-mobilizations in the world, but the results for you will be minimal, if any, if you don't, in between bouts of exercise, maintain good head and neck posture. How do we find good head and neck posture? Well, the truth is, good head and neck posture varies from individual to individual, and it will also vary within an individual as we age, and it will also vary as our range of motion or flexibility increases as we perform exercises. But regardless of that, the way that you find good head and neck posture is to do this. You simply retract your head, give yourself that little push, then gently, by little degrees, allow your head to come forward just enough to where you take the strain off. That's good head and neck posture. In other words, it's not way back here.
At the extreme of the retracted position, that would certainly be uncomfortable.
But on the other hand, it's not way forward here either. This would be the worst position that you can get yourself into, sure to produce pain. It's somewhere in between, and you find it
by retracting, giving yourself the little push, and then by very little bits and pieces, letting your head come forward until you take the strain off. That's good head and neck posture. And simply correcting your posture in the way that I've just demonstrated, doing that alone and not any exercises is oftentimes enough to completely get rid of any pains. So if you're in this position, if you're forced to be in the sitting position at work, working on the computer, whatever it happens to be that you're doing, when you're sitting for long periods of time and you feel that strain and pain developing in the neck, upper back, and shoulders, simply correct your posture, letting it come forward just enough to take the strain off.
Simply correcting your posture alone without performing any exercises or self-mobilizations, that alone oftentimes can be enough to completely get rid of the pains right then and there. There are some patients, there are some people who, despite their best efforts at performing the exercise that I've just demonstrated in a mild and gentle manner, manage to produce nothing more than pain even the first time they perform it. If that's the case, if that is the case with you, then there is a more remedial version of this exercise that you need to perform. I'm going to demonstrate it right now. As far as movements goes, it's identical to the exercise that I've just performed, but it's done in the lying position. In the lying position, this oftentimes makes it much more tolerable for a patient that's in a lot of pain and is simply unable to perform or tolerate the exercise in the sitting position as I've demonstrated. They need to do it in the lying position, and I'll do that right now. You simply lay on a table or possibly your bed, that may be all you have available, lay in this position and perform the exercise almost identical to the way that we performed it. I demonstrated it in the sitting position. In other words, first perform the retraction, the sliding of the head backwards, then move yourself to the edge of the table or bed, whatever it is that you have available to you. Take the strength of your arm to support your head, and then just like in the sitting position, slowly bring your head backwards. When you feel the strain, you add the little rotations as you try to go back just a little bit further, and then the hold. Then, using the strength in your arm, bring your head back to the neutral position, slide yourself forward in between each repetition. This should be done. This exercise should be done in this position only if you're unable to tolerate performing it in the sitting position, or you simply have too much pain while you're in the sitting position. Then perform it lying down, and you'll feel a dramatic difference. It will be much more easy for you to perform. But as soon as you can, as soon as you're able to do so, perform it in the sitting position. It's very important to keep in mind with these self-mobilization techniques or therapeutic exercises that you never push yourself to the point of pain. You have to move with these exercises far enough to where you feel a strain or a stretch type feeling. You have to feel something or you're not producing any effect. But you should never ever push to the point of pain. A strain or a stretch is all that you should feel with each repetition. If in doubt, do it a little bit less severely, a little bit less range of motion. It's always better to do a little bit less than to overdo it and produce more pain.